Good morning everyone and welcome to Health Horizons. Our series is designed to support leaders in your business by addressing the challenges and opportunities that are shaping the future of workplace health and wellbeing. It's part of our commitment to keeping you updated on emerging trends, cutting-edge technologies and evolving practices in healthcare. We aim to anticipate challenges and opportunities that shape the future of workplace health and wellbeing, so you always feel one step ahead. So today we'll be discussing family and fertility. More people than ever before are having fertility treatment. There were 10% more IVF and donor insemination cycles in 2021 compared to 2019. Single parents and parents in female same-sex relationships had the largest increase in IVF usage from 2019 to 2021. And male infertility issues have risen over the last 2 generations, with 16% of those under 34 being impacted by fertility. According to the 2022 Fertility Network report, over 80% of people felt that their fertility treatment had a significant impact on their mental and emotional well-being. Today, we'll discuss why businesses need to develop a strategy that not only supports employees navigating fertility treatment, but also prioritises their mental health throughout the process. By fostering an environment that acknowledges and accommodates the challenges of family planning alongside professional pursuits, businesses can empower their employees to pursue both aspirations without feeling pressured to compromise. So, for today's session, I'm pleased to be joined by our 5 experts. Joining our panel today are Rebecca Rohrer, Medical Director at Bupa, Charlotte Gentry, CEO and co-founder of the IVF Network, Rosie Leverton, Head of Corporate Partnerships at Tommy's, and Jenny Rolfe, UK Head of Benefits and Wellbeing at City. I'll also be welcoming Adam Gentry, Wealth Manager at Bruin Dolphin, who will be joining us virtually. Send us your questions throughout the session and we'll answer as many of those as we can get to later on. And of course, we'll have some lovely polls. We know you love a poll, so we'll get to those as we go. So let's get going. Right, okay, so welcome everybody. Ready for a good grilling? Okay, so look, I'm going to come to Jenny first. So Jenny, from your perspective, have you observed an increase in inquiries or requests from employees regarding workplace fertility treatments?
Yes, yeah, in short, yes, we have. And that's why we put it into our medical plan in 2022. So we took the decision to put it into our core plan that everybody gets for free at City. And that was really off of the back of the invoice of the employee survey that we do each year. It was requested there. And also from our employee networks, Pride, Family and Women's Network particularly were the ones that were most vocal about it. We want to remain a top employer for working families and also the data, which you've alluded to in your intro, lack of data and that postcode lottery as well. So they were all the reasons that we put fertility into our programme.
Great, thanks for elaborating. For a moment, I thought you were just going to say yes. Okay. Rebecca, coming to you next. So what factors do you believe are driving the rise in demand for workplace fertility treatments?
So I think those factors are kind of outside the workplace and inside the workplace as well. So outside, the demographic changes are really profound. So, the average age that we're all having children is increasing. It's the highest since we started taking records in 1938. So that's 30.9 for women, it's 33.7 for men. And that means that, that more couples are having fertility challenges and medical advancements have kind of responded to that. So, fertility treatments are now more accessible, they can be more affordable and they're more successful than ever before. And I think there's also this kind of socioeconomic factors in place, both in terms of people are more open about their fertility challenges, about reproductive health in general. So people are more willing to investigate whether they might have fertility challenges and then seek help if they do. And I think within the workplace, workplaces are really responding to that. They're listening to their employees. They're more likely to, have communication programs for reproductive health, for example, more likely to have really diverse representation around, what family support is in place and to offer fertility benefits.
Great, thank you very much. I have to say, when we started looking at family, I was really naive about it. I just thought it'd be really easy.
Yep.
On we go, and it wasn't. But anyway, that's another story. Okay, so Charlotte, in your experience, what are some of the challenges organisations face in meeting the potential increase in demand for fertility treatments in the workplace?
I think first and foremost, a lot of businesses are needing to demonstrate that they value their employees and that to mitigate the issues of losing employees based on people being unable to balance having a career and undergoing a fertility journey. So I think that's the key catalyst, really. But I think one of the key problems that a lot of businesses are facing is that they've got a certain amount of money to pay for a lot of different employee benefits these days. And so they're having to look at mental health, they're having to look at menopause, they're having to look at fertility, and trying to slice and dice that budget is one of the key challenges that people are facing. Also, because so many more people are experiencing fertility-related problems, they are having to educate their line managers and their HR people to be able to have those difficult conversations. And a lot of businesses don't necessarily have a fantastic open culture where people feel safe, and I think the safety element is really, really crucial, combined with finding the right support network that people can tap into. So one of the key challenges that businesses are facing is that they might want to implement different products and different service offerings, but actually they're looking at the utilisation rates of those. So they're quite expensive, and that's a challenge in some areas, but also a lot of platforms and apps and what have you are now having to really demonstrate the utilisation rates and actually the value that they are spending in terms of those support services.
Yeah, great. Thank you. Having a psychologically safe environment is so important, isn't it, for everyone to feel free to have that discussion.
Sure.
Actually, when you were talking, I was thinking when you were talking about menopause and everything else, I mean, this is such a key part, isn't it? You're almost missing something out if you don't put fertility in there as well. Get the expense point. Right, Rosie, I'm going to come to you next. So, in your view, how do you expect workplace culture and policies to evolve so that they can better address pregnancy and baby loss and support employees?
So at Thomas, because we're the leading pregnancy research charity in the UK, we see a lot of people who we care for who have had fertility issues and then may go on to lose that baby, or they can have secondary fertility issues. And so when you think about fertility policies, it often goes hand in hand with starting to widen your thinking around, well, what is our response if someone loses that pregnancy? Or actually, if we're kind of saying that this is important to us, what else do we need to say that is important to us? Because it's all part of a spectrum, kind of pregnancy journeys, if that ends in loss, in premature birth, or is a difficult journey to get pregnant in the first place. So one of the things we've really seen shift, I would say in the last 4 years, has been having really explicit standalone policies for fertility and for pregnancy loss. And I think that's a huge step forward, because previously, when I talk to companies, they would often say, well, we'll deal with things on a case-by-case basis, which would always be the case. But what that does mean is if you don't have an explicit policy, people who are already feeling quite ashamed, may not have told their work that they're pregnant, don't feel able to access support, which is really not the intention of the employer. Like, very often it's the intention, we just want to support people as and how they need it, but without something explicit, you're not giving any kind of starting point for managers, for HR teams to work off of. So that's a really big shift that I've seen, and particularly being really explicit that these policies cover loss before kind of 24 weeks, because there's little statutory support when it comes to miscarriage in particular, and also being really explicit about who those policies are for. They're for kind of women and birthing people only, or are they for partners as well? I've seen some policies where it can be anyone impacted by the loss of a baby. So that kind of thinking has really moved on in the last 4 years, I would say. But then kind of coupled with that is an understanding that it does need to be flexible, that grief isn't one size fits all across any kind of policy, whether it is other issues like mental health, like that kind of idea that there isn't a clear cut kind of this happens and then you come back to work and you're fixed. But that understanding, I think, with pregnancy loss and fertility is still, policies really need to be accompanied by that training support for managers that you mentioned, because they're kind of a good framework, but they need to then have someone who's got the ability to apply them and to understand when they're not going far enough and what else that employee might need that sits outside of policies themselves. That need for flexibility and building that into policies is something that we've really seen shift over the last couple of years. And the other thing I would just say is the surprise that lots and lots of organisations experience when they introduce support for fertility, for pregnancy loss. Really, kind of how many employees kind of say, "Oh, thank God! Like, this was great. We're so proud that our workplace has done this." We hear often that it takes just kind of a couple of people sharing their story for that to really kind of open a floodgate. So I'd say I'm seeing more and more organisations actually feel brave enough to take steps and then be really kind of surprised by the positive response they get.
Right, so strong policy, treat people as individuals.
Yeah,
And I guess leaders role modelling and showing some vulnerability.
Absolutely.
Makes a difference, yeah. Okay, great. Thank you very much. Now, I know everyone's been waiting for this, but it's our first poll. So it's very easy. It's yes or no. Is your business taking steps to address the rise in demand for fertility treatments? Should be up on your screen now. Okay, so we're now moving on to talk about whether societal shifts are amplifying fertility issues in the workplace. So Rebecca, I'm going to come to you first. So how do you believe societal changes, including evolving family dynamics and economic challenges, are influencing employees' decisions about fertility?
Yeah, they have a massive impact. I mean, I think about a number of factors in terms of kind of what's pushing people towards fertility treatments and what's pulling people away. I think the kind of changing nature of family is really interesting here. You know, I think as people have children older, they're often sandwiched between caring responsibilities, maybe for older people in their family, and child rearing, which is kind of, you know, very new as a society. And that can mean that people delay, you know, starting a family at times. And it's, you know, extremely difficult for them to go through fertility treatment and manage it, you know, with their other caring responsibilities. You know, I think marital difficulties, relationship breakdown, divorce can also cause people to delay, you know, reproductive decisions until later in life and mean that they're more likely to have to engage with fertility treatments. I think the socioeconomic factors are really interesting. You know, I think during the cost of living crisis, you know, people may not necessarily have the ability to pay for fertility treatments, and so that creates a real gap for workplaces to be able to support people even better. But I think a lot of people are also delaying decisions about having children because they're concerned about, you know, the cost of childcare, the cost of housing, and so that means that, you know, again, people may take people until their late 30s, even early 40s, until they're in a position where they feel that that's right. And what I hear a lot from patients as well is actually that these bigger kind of geopolitical forces are actually making people question whether they want children and how many children they want, you know, kind of geopolitical uncertainty, even the climate emergency. People are really questioning how many children they want to have or if they want them at all. And I think what's interesting for us as well is this kind of shift in gender roles. You know, that creates challenges because couples are often, you know, having two careers within a family, but also that creates lots of flexibility, particularly for women as traditional caregivers, to be able to go back to work and for men to be able to do some of the early childcare in particular, and creates a real opportunity for workplaces to step in and be flexible about that.
Great, thank you very much. So Jenny, I'm going to come back to you. So in your experience, how do you think factors such as longer working hours, increased job-related stress and changing career expectations are impacting fertility rates in the workforce?
Yeah, I mean, I think it'd be wrong to say that jobs don't impact that, but I do think it needs to be, if it's something that's important to you as an individual, that you need to look at all aspects of your life. You need to set boundaries both at home and in work. Obviously an employer, you know, giving you the culture and the support, that's really important. Upskilling our line managers, as we've talked about, all of those things can help what can often be a difficult journey and an emotional journey, but you know, the company can only play so much of a part of it, but they absolutely do have a part to do, yeah.
I think you talk about upskilling line managers in particular. They've got such a big role to play, haven't they, in terms of engaging with their people and making it okay to have the discussion. It's not an easy discussion to have, but actually just having it goes part of the way, I think, or at least gets things going. Okay, Charlotte, I'm going to come back to you. So could you share your personal experiences regarding fertility challenges in the workplace and how it impacted your life, including your career path and mental and physical well-being?
So I've been an entrepreneur pretty much all my life. So that brings with it different challenges to a lot of people who are working in a corporate environment. Although I've been within that corporate environment, even though I've been an entrepreneur all my life, because we've had a corporate events agency, which is very highly stressed. So stress management has been a very key part of that, for sure. And I was travelling an awful lot in my 30s. So really building the agency took over the whole of my 30s and pretty much a large pocket of my 40s, actually. So trying to create that balance was very difficult for me. I didn't necessarily have anybody to report into to ask the relevant questions or permissions or what have you. So I had a certain amount of flexibility, which perhaps other people don't have necessarily in a corporate role. However, my challenges were just very different about, can my business survive without me if I take some time out? Can I do this without destabilizing my environment by telling people what I'm going through? Do I want people to know what I'm going through? So it was very challenging. I didn't meet my life partner until I was in my very late 30s. So that meant that I knew that I was going to encounter challenges moving forwards anyway because of my age. And it was just very, very difficult. I actually did take, I think, 8-9 months out to try and redress my nutritional aspects, my stress management issues. And actually we moved down to the countryside out of London just to try and sort of mitigate some of those key factors that I was experiencing. And even when going through the fertility journey, it wasn't simple. We bounced around from clinic to clinic for a bit, and eventually ended up actually completing our treatment in the US for various reasons. However, just gaining that knowledge and that information, because there's a lot of noise out there about what you should do and how you should make the process work, was very, very hard to navigate one's way through that. So getting the right information from the right people and also having the support of family, friends and your working environment is all key to success, essentially.
Great, thank you very much. It sounds like quite a journey.
It's been quite, it's not for the faint-hearted. And, I sincerely hope that a lot of people don't have to take as long to get through the journey as I did, but just being able to have open conversations and gain that support from your organisation is definitely very much a key part of it.
Yeah, absolutely. Great, thank you very much for sharing. Rosie, coming to you. So how does pregnancy and baby loss affect workplace dynamics? And what are the potential impacts on employees' mental health?
Well, significant. We know that 80% of people that are going through fertility treatment are stressed about the impact on their work. So that's before they've even got pregnant. And then if you add loss into the mix, I think quite often the feelings that people talk about are that they're ashamed, they're anxious, they're guilty. And some of that is related to the experience of losing a baby itself. But that feeling of shame actually is one that the workplace can play quite a big role in reducing. And the other thing that people talk about, particularly with work, is isolation. So we know that actually over half of people that come back to work, no one will ask them how they were or what happened. And I don't think that's because people don't care. In fact, I think we know that it's because people are just so scared of saying the wrong thing. And as a result, they just avoid their colleague when they come back because they just don't know what to say and they don't have those tools to be able to have that conversation. I always remember a parent saying to me, you really see it in people's eyes when they see you coming down the corridor for the first time and they're thinking, oh my God, I can't mention her baby. I don't want to remind her of that grief. And she's saying, I will never not be reminded of my loss. And actually parents really love to talk about their babies and asking things like, what name did you choose? Why did you choose that name? It helps prove to parents that baby did exist and exists to other people other than themselves. But that isolation can be really tough for parents coming back to work. And I would say generally it's kind of a real turning point in the relationship you have with your employer if you go through a loss. And that depends whether it's obviously a supportive or unsupportive experience. But what I would say is the people that I've spoken to who've had a supportive experience, I've had multiple parents say to me, it would take so much for me to leave now. That feeling of gratitude and the way you view your employer. And I've got some good stats actually that I'll share for anyone that's looking to make a business case, because it really, really is a kind of key moment where if you get things right, and getting things right, it's not always like the big things. It is the way that you make someone feel really makes such a difference. But just coming back to what you were saying, Rebecca, around the role that workplaces play, particularly in supporting people's mental health through fertility and through pregnancy loss, I think there's a really important role that workplaces have to play to say this is important. You should, if you have fertility treatment, we're giving you permission to take time off because we acknowledge that this is a really stressful thing. And equally, when you have a loss, similarly saying to their employee, we recognise that this is a huge thing that's happened to you. We know particularly when it comes to partners, to dads and partners, that they will often go back to work really quickly. They might not even take any time off. And having a policy and support in place that says proactively to men, this is important. You should be recognising your grief. We think that if you want to, you should be at home with your partner and be healing together. I think workplaces have a really important role to play in helping men particularly address their grief that otherwise they kind of sweep under the carpet because they have to be the strong one for their partner, and they're not the one that the loss perhaps physically happened to, so they feel unable to grieve in the same way. But I do want to end on just some more positive stats, because I think through fertility, through pregnancy, through loss, if you can get these kind of moments in an employee's life journey right with you, then people will stay for so long, so much longer. So we work with an NHS trust called Birmingham Women's and Children's Hospital, who've done a lot to help support their employees and to really lead a bit of a sea change in the NHS and how pregnancy loss for NHS colleagues is addressed. And so they've had a policy in place for 10 days of leave for the woman or birthing person and 5 days of leave for the partner. I'm going to check my notes so I don't misrepresent their stats, but they found that offering 10 days of leave meant that people only took 5.5 extra days, because of course people are still taking leave. It's just not called pregnancy loss leave, it's called sick leave or annual leave or some other leave, but it's happening. Yeah. So it's only resulted in 5.5 extra days. But the increase in how people reported that they felt supported mentally, physically, listened to, taken seriously and valued more than doubled. The way that people said they felt that they were more likely to stay, feel positively about their employer, more than doubled. And what was really interesting is that men reported that they were 4 times less likely to leave if they'd been offered a pregnancy loss policy than if they hadn't been offered one at all. And that actually, even if someone hadn't directly experienced the loss, people were also surveyed who were just colleagues of people who had experienced loss, and they reported similar feelings. So that idea, this kind of halo effect of if you put proactive support in place, it obviously is a massive help to the people that it directly helps, but it has this effect across the whole organisation of improving morale and how people view you, as well as obviously giving people the tools to open those conversations when someone comes back to work, and give people the opportunity to support their colleagues the way they would like to, but probably don't know how to.
Yeah, sure. I mean, those business stats are fantastic, but in reality, it's just, you should just give people the time.
So often it's just simply having the courage to say, how are you? And they might not be ready to say anything, but in that case, they know that you're there when they are ready.
Yeah, absolutely. Give them the time, the space, and engage with people as well. It's much worse for them than you saying, how are you?
Yeah, exactly.
Okay, thank you very much. Right, thanks everyone. We're going to be returning shortly, but we're going to go to the video, I think, now. So it's time to move on to our session with Adam next. So we discuss how fertility treatments are on the rise, and we've heard first and how. Sorry, I'm not doing a very good job of reading this. Right, we've heard first and how fertility challenges can impact a person's career path and mental and physical well-being. However, a crucial aspect that is frequently overlooked is men's fertility. Men who struggle with fertility issues are often report high levels of stress and anxiety, leading to reduced productivity and engagement at work. A lack of support doesn't just impact men's well-being, but also carries significant implications for business. So I'm delighted to welcome Adam Gentry, who will share his own personal experiences of dealing with fertility.
Yeah. Morning, Richard.
Hi there, how are you doing?
I'm well, thanks. How are you?
Excellent. Very good, thank you. Very good. We're having a very good session here. We're excited by having you with us now, and I'm now going to give you a good grilling, if that's all right.
Yeah, please do.
Excellent. Okay. So Adam, can you share your personal journey with fertility and how it impacted various aspects of your life, including your job performance and mental well-being?
Sure. So firstly, thanks for having me. The journey we had was very much a combination of highs and lows, and some of those had significant challenges linked to it. It's full of various emotions, as the panel have alluded to. We were very fortunate to have some incredible family members, friends and colleagues that were there to support us. So personally, my previous boss at my old firm was hugely supportive and went through a challenging family event himself. So he was a good kind of shoulder to lean on and get some advice around. Physically, there were some changes made in terms of, the various aspects linked to it life-wise. I made some significant alterations to nutrition and exercise routines. So things like eating no red meat, no processed meat, no processed sugar, Sounds quite boring so far, doesn't it? No dairy, no caffeine, which is the worst. I'm sure my wife might have a difference of opinion there about giving up coffee. No alcohol, changing weight routines, going to the gym, etc. So doing more cardio and kind of less strenuous exercises and changing that for like Pilates and yoga, all made a significant impact.
Great. And how was it? How was making that change? Did you find it easy or was it difficult? Or
I think at the start it was pretty strenuous. After, when you get in, like most things, when you get into the routine and the swing of things, you start to just understand what's working. You start to feel the differences. They might be slightly smaller ones at the start, but then incrementally they grow. And after 12 months, I felt a lot. No alcohol for 12 months, for example, no red meat, no dairy, all had significant changes to how I felt physically and mentally.
Yeah, no, I'm sure. Okay, so how do you believe the conversation around male fertility needs to evolve in the future, and particularly in terms of reducing stigma and raising more awareness?
Yeah, great question. So I think there's some really good content out there at the moment. I mean, I'm a huge fan of podcasts and listen to Stephen Bartlett, the Diary of CEO, a lot, and he had Dr. Michael Eisenberg on there a couple of weeks ago, who's Professor of Urology at Stanford University. And some of the stats that he was coming out with in terms of research on male fertility issues, microplastics, how that all comes in from a tech perspective. And all of this comes back to kind of what I've alluded to already. The simplest lifestyle changes for men can have a huge impact on fatherhood. So I think there's some great content out there. I still think there's clear scope in helping individuals and educate them on what shouldn't be eaten, what sports work, what approaches work, what clothes to wear, etc. And I think all of this content can be put together to help one's fertility journey and ultimately have a higher success rate.
Yeah, absolutely. And this one isn't scripted, I'm afraid, but it strikes me that how much do you know about this before you were in that situation, or is it all new learning for you?
Yeah, great question. So a lot of it was new learning. A lot of it was just, Googling a little bit, speaking to doctors, speaking to a lot of the practitioners and understanding what everyone's got a slightly different approach and maybe slightly different way of communicating it. But you take in snippets about what's worked for other couples. But, that's where things like topics like today, panel discussions out today and various platforms can be so educational for individuals, because hopefully that will just add so much content to one platform that allows people to just, from an education perspective, really understand it and really evolve it as well and develop it.
Yeah, absolutely. I mean, as a male myself, you might have noticed, I'm exactly the same. Until you get into that situation, you've absolutely got no idea, have you, at all, even that it would be a problem to start with. I mean, so there's a load of education to be done, I think. Anyway, so based on your experience, how do you think organisations can enhance support for male fertility and address any associated mental health challenges in the workplace?
Yeah, I think a lot of, particularly in finance sector, a lot of firms are making changes to their processes, and we've heard about it, permission for time off, etc. But I think there needs to be a wider overview of what that process looks like and how institutions can add to it to make sure they've got a good idea about what success looks like for all involved. I think when the foundations have all been put in place and built, then it will allow people to have, male and females to have families and obviously be successful. But I think there's quite a long way to go with that. I mean, I know obviously we've got City on the panel, but some of the larger global institutions have got IVF process in places, for example. So they contribute financially and allow career-driven women who are particularly in their 30s to have a family. So they would help contribute towards payment for IVF. So from what I've heard, this has been a key driver in helping firms like that keep some of their female staff and the retention rates higher. From the male side, I think there's a huge amount to go, particularly, like you said earlier, from an education piece, but obviously from a wider overview of processes to be implemented as well.
Great, thank you. And thank you so much for joining us, Adam, and sharing your story. It's very kind of you, very brave as well, to come on a panel like this and talk to us. So thank you very much.
Thanks for your time.
Great. Okay, so before we wrap up, let's ask our panel a few final questions. Please get your questions in to us as well. I should be answering some of those in a minute. Will be coming in on the iPad. So we're going to move on and see how businesses can stay ahead of emerging trends in fertility and support the health and well-being of their people. So Jenny, I'm going to come to you first. So what strategies do you think are most successful in fostering a workplace environment where all employees feel supported in aligning their career ambitions with their family goals?
Yeah, I think it's very much like we've all been talking to. Like, it needs to be robust policies, it needs to be, and those policies need to be communicated, not just put on a SharePoint somewhere and not talked about. I think it's about supporting our employees through that whole journey and all points. So I think it starts with your interns and your grads. Let's have those really what are deemed difficult conversations. Get them used to talking about taboo subjects right at the beginning of their careers, and they can carry that forward. They're going to be our leaders of the future. So I think it starts there. It's supporting families, and I mean that in the widest sense of families. So we've talked about that families can be complicated. So yeah, it's helping those. So that's both with elder care, childcare, fertility, it's leaves, it's all of those things. And I think doing it from day one of employment as well, that's one of the things that City done recently. All of our family leaves are pretty much from day one. So it helps if you are sort of, especially if you're a woman and you're looking to start your family but want to move in your career, you're not restricted by, I'm not going to get my maternity leave if I move at this point in my journey. So I think those sorts of things that we've been doing have really helped. And it's the emotional support as well. So that's something that we put a lot of time and energy into at City. And we've taken away our caps, we've taken away our barriers. There's lots of different entries into getting emotional and mental support, be it face-to-face, that's on-site or off-site, it's remote, it's having an EAP programme like most organisations have. But I think it's just sort of giving people the options, you know, what works for them and what works for them at their life, and opening up those options to their family as well. And finally, we talk about it, and we talked about education and that openness. So we talk about it in, we call them moments that matter in life. I don't think we've coined that. I think it was out there already. But talking about moments that matter, the good and the bad. And we've had various different senior leaders talk about those moments in their life and how they have either been well supported or maybe not so well, and what we're doing to change that. And we've also asked individuals at other levels, because I think when we started doing that, it was very much seniors, and we did get a bit of feedback. Oh, it's all right for them, they're established in their career. So we opened that up to all of our colleagues to come and share their stories and talk, and we find that is the best way to bring our policies to life. It inspires people that are perhaps having challenges to come and seek help, and I think overwhelmingly people tell us it makes them feel not so alone, and I think you talked about that. So that's sort of what we're doing at City. I think you can always do more, but I feel like we do try to do the right thing and help our colleagues along the way. So I'm sure there's more to come, but that's what we're doing at the minute.
Right. And did you get lots of engagement, lots of people wanting to share their story?
We did, yes. Interestingly, we did. So we've done a number of different topics, and perhaps topics that were a bit taboo, I think. So we had a number of colleagues share their fertility stories, some who had a successful outcome and some that didn't. And we've very openly talked about the menopause in the organisation, so we've been doing that for a few years. Last year we launched our men's health campaign, and to really get our men to open up and discuss. That come out of our Voice of Employee as well, because they said that they didn't feel like they were represented in our programme, or as well as other groups. Yep. So I had sort of walked in one of those water cooler moments. Two of my colleagues were talking, and I look after the healthcare programme. They were like, "Oh, I've had this amazing experience," and they started talking to me about a quite sensitive topic and a medical experience they went through, I'm not going to lie, I did feel slightly uncomfortable. But I was like, right, we've cracked it. We've got our male colleagues talking about something that they would never have talked about before. So yeah, that I felt proud in an uncomfortable way. So I feel like I think it's working. I think what we're doing is working.
Shows you created the environment for
Yeah.
people to open up. That's great.
Yeah.
Okay, so Rebecca, I'm going to come to you now. So how can organisations ensure that their fertility policies are inclusive of diverse employee needs?
Well, I don't think it's one policy and then it gets, stored on the shared drive and then you leave it. I think it's a kind of cycle, and for me that includes culture. That's the kind of magic sauce in all of this, and then planning for those policies and then evaluating how they're working and kind of feeding those all into each other. So I think culture, I mean, you spoke about it so beautifully, I think that's partly around, campaigns of awareness with diverse role models talking about their experiences. So single parents, LGBTQ plus couples, people who are younger, people who are older. So I think that's really important, just to open up those conversations as wide as possible. And ideally have people from inside and outside the organisation, actually. I think in terms of the policies, it's not just about a fertility policy, it's about the policy for mental health support, to support people before, during and after. It's around a fertility policy that extends into recommendations about information sources. Google is great for many things, but actually you want to be able to guide people to reliable sources of information that is going to educate without necessarily scaring people, I think. Yeah. And then, around all of the support around fertility appointments take time, and actually there isn't necessarily the flexibility within a workplace to be able to allow that. So, being upfront with the organisation providing the fertility treatment, how many appointments are we talking here? Setting expectations as early as possible, that it might be a monthly appointment or a weekly appointment. And then all of the things that come afterwards, actually, how much support are you allowing for parents? Can you start parental leave early if you do have, a child in the neonatal unit or complications during pregnancy? Can people compress work weeks, have flexibility around start and stop times? So it's all of those things as well. And I think, evaluation is really important. What are your utilisation rates? The places that you're sending people, how well is that working, and what feedback are you getting from your employees about how that's going, so that you can then feed that back into the cultural piece.
So you can continue to evolve your policy,
Absolutely.
but it's about treating individuals still, isn't it? That's really the long and the short of it. Great, okay, thank you very much. We've got loads of questions coming in, by the way, so you're not quite off the hook yet. But before we get to that, Rosie, I'm going to come back to you. So in what ways can Tommy's help businesses that may be struggling to know where to start or that want to improve support of their employees impacted by complex pregnancy journeys?
So I think the first thing I'd say to anyone kind of thinking about this topic and thinking, they might think, oh gosh, this is bigger than I thought, or it feels more complicated than I thought, is that there are so many organisations and so many experts out there that can help you with this journey. So obviously Tommy's is one of them, but there are others out there. There's people like Fertility Network UK that are kind of more specialist. But at Tommy's we have a pregnancy and parental work training programme, which is designed with kind of HR leaders. It was designed with businesses, with line managers, with employees, with parents, with midwives. So it was designed to be really useful. And the kind of crux of that is training for HR and line managers to help them have those conversations through pregnancy loss and premature birth, and through fertility challenges as well. And that also includes things like policy templates, because actually there is no reason why anyone should be writing a fertility or pregnancy loss policy from scratch now. There are lots of examples out there. There are businesses that have gone before you, and then there are people like us who have spoken to lots of those businesses and have kind of synthesised that into a template. And then we talked about comms and the kind of cultural piece and conversations. One of the things we do that works really well is we have a team of in-house midwives who run our pregnancy helpline, but they also can come into businesses and do sessions with colleagues to talk about, well, this is what your colleague might be experiencing if they've gone through loss, this is how to talk to someone. And those are incredible for helping kind of that conversation piece. And you see kind of the teams, often they're online, you see the teams chat kind of start to come alive with people feeling able to share their own experience, often for the first time. We've done some of these sessions with Bupa. Bupa has been a founding member of the Pregnancy and Parental Work programme, actually. and is also a champion of, which means that they've got kind of enhanced policies that go above and beyond like the standard, what you might expect at an organisational level. And then the final thing I would say, just on anyone thinking about this journey and starting this journey, I think Jenny, what you said around employee groups was so helpful, and also about senior leadership. I think those are the two things we've really seen work really, really well, is when you've got someone senior who is willing to kind of champion this support and to talk about it. Yes, if they've had an experience themselves that they're willing to share, but even if not, that kind of senior voice is really important. And then similarly, I would say employee groups, not necessarily always, I think in terms of listening groups, like quite often the recommendations that come out of those tend to be the same across business to business. So that's something like, if you want recommendations like we can help with at Tommy's, but actually where those groups really are invaluable is creating champions across the business that then when you launch this support, they're there saying, this is great, like we helped shape this, or, you know, they're willing to share their stories, like Jenny said, which is just unbelievable. When you get one or two people sharing their stories, the way that kind of snowballs and becomes really self-sustaining is really quite amazing. So I'd say to anyone thinking about this journey that please, like, it might feel like quite big and scary to address and to get things right, but there is so much support out there to get things right. Like I said, we've got our kind of training and support, which actually if anyone is watching who's running a business that's got less than 250 employees, they can actually get government funded access to get it for free. So there really is no excuse. But I just really want to emphasise that there are so many organisations out there that have trod this path before and have lots of learnings to share, and that as an employee, they just want to see that you're being proactive. You're not going to get everything right, and there's not an expectation to do that. Really what they want is for you to try and to work with people like us at Tommy's, like the other organisations that are out there, to do the best that you can.
Great, thank you. I haven't seen too many standalone policies just sitting on a shelf doing much. It's all the engagement, isn't it, and networks and so on, bringing it to life.
The number of people have said we launched this policy and then a year later people don't know it's there, and you're like, that's because you didn't follow up with, talking about it at all.
Go and look in the policy library. Yeah. Okay, great. I'm not even sure we've got one of those actually. We probably should do. We've got a lot of policies. Okay. Charlotte, coming to you. So in your experience, how do you think organisations can better support employees balancing their career goals with family planning aspirations?
I think there are a number of ways, and I'm going to circle back actually to Rebecca's point, which is that information actually has to come first. There are many organisations who are incredibly supportive and generous by providing financial support, but actually when it comes to going down a fertility journey and a pathway, you can have all the money in the world to have access to specialists, but if they're not, if you don't know exactly where to spend it and you haven't got that knowledge, then actually money is unfortunately in this game like water, because it's being completely truthful, it may not work the first time you go down that IVF pathway. So the knowledge piece is absolutely pivotal, the knowledge and the support to stop people feeling isolated. Based on what Jenny was referring to, the isolation piece, especially in the workplace, is a very big piece, and having a community of people to be able to go to relate to have those discussions with or what have you, and that's part of what actually we provide at the IVF network, alongside that knowledge support of knowing who the right people are to get the right information from, to be able to make the right measured decisions. And as somebody going through the process, that's what you really need, as opposed to getting the wrong information. And there's a lot of information out there, and there's a lot of noise out there. So getting the right information is absolutely key. The other piece, obviously, is around creating that safety piece and the the feeling of being able to trust your employer and being able to trust your line manager, and knowing that you've got that open conversation at work that's valued, so that you're not afraid of your career collapsing because somebody thinks that you're going through or knows that you're going through this process. I think the other element is that it's not just a female orientated issue, and I think that is a perception for a lot of businesses still, is that it is very female driven. I mean, I know my husband definitely felt like a passenger on the journey. Men have even less control than women do through this journey, and that for the impact of mental health there is really, really significant. So for men, having that level of support and, as Rebecca referred to, the LGBTQ pathways to parenthood as well is really, really key, and recognising that as well. And finally, I would say that it's not just for people who are trying to have a family today or tomorrow, but it's actually the future-proofing of fertility is really, really important. So the amount of, and I'm not going to get the statistic right, but there's a huge increase in the egg freezing statistic of people who want to freeze their eggs based on not being in the right stages of life, currently to have a family and what have you, but there aren't actually enough egg banks to actually house a lot of those eggs now. So we have a growing challenge there. So the increase in knowledge around future-proofing fertility, understanding that vaping is criminal as an example for male fertility, it basically kills sperm, understanding what these external factors and the impact of those is really, really important. So that comes back to knowledge again, and understanding that it's not just about, and for people who are within the age groups of, 28 to 38 who are very actively looking to have a family, but it's much more diverse than that, and it's looking at how people are preparing themselves for having a family in their early 20s all the way through now to their mid-40s. And what that looks like through that entire demographic. So all of it's an integrated fertility strategy, if you like, that companies need to be now looking at, and the educational piece where the knowledge feeds into the actual practicalities of the assisted fertility care that Bupa might be providing currently, to be able to know how to choose that provider, what the questions are to even ask when you walk into that consultancy meeting. I certainly know that I was a bit like a rabbit and caught in the headlights in the first consultancy, and the money that you can spend, even if you are you have the private healthcare, is challenging, because you just have to keep absorbing information. You don't really know that the information that you're absorbing is 100% correct, but if you've got access to the right information, that's definitely a large part of the battle.
Yeah, right. Thank you. I was thinking, actually, when you were talking as well, trusted quality information is kind of key, isn't it? Because if you Google any medical, we've all done it, I have anyway, it's pretty scary usually. So yeah, quality information is so important. I'm going to come back to you in a second just to warn you, because we've got some questions here, but we're going to do another poll. Okay, so the first poll actually was, is your business taking steps to address the rise in demand for fertility treatments? 52% of you said yes. So it's quite a big unmet need with 48%. Our second poll is, should organisations play a more active role in trying to stay ahead of emerging trends in fertility? Yes or no? Okay, great. So coming back to you, I did warn you. What advice would you give someone facing fertility challenges while balancing work responsibilities?
To get information from the right place to start with, to look at their lifestyle factors and start to look at, I wish this is what I'd done to begin with, look at nutrition, look at the way that their life is mapped out, if you like, in terms of how they can gain success sooner rather than later. I honestly believe that if I had access to the IVF network when I was going through it, in terms of the collection of the right specialists delivering the right information, probably my journey could have been halved. I mean, I spent 4 years before I had my son in the system, simply because I didn't have the right information. I ended up in the wrong places. So it's time that you spend out of the office. It's emotional trauma. You feel like an inherent failure. I've been through terrible trauma, really feeling like I'm never going to come out the other side, and getting the right information and knowing who those right practitioners are to be able to take you on the journey and believe and trust and feel safe with those people. But I think in terms of trying to balance the career piece, is just be kind to yourself at the same time, because at the end of the day, at some point, your want to have a family has to take precedence over, whether you're 5 minutes late getting to the office. It's probably not the right thing to say, but you have to start putting that first, because otherwise you'll feel like you'll never get there. So just be kind to yourself and give yourself the time and the space. Make the space.
Yeah, absolutely. Thank you very much. Okay, Rebecca, I'm going to come back to you now. So how can businesses stay informed about fertility trends to enable them to provide support to their employees?
So I think that goes back to reliable information sources. So I think, potentially as an outcome of this, we could send out kind of a potential guide to some of those information sources, and just having a kind of a reliable trends tracker from good sources that makes you understand what's happening in the marketplace. And I think also looping back to employees who are going through the process saying, actually, what would have been helpful at this point and at different points in the journey? Because what's helpful when you're planning your reproductive journey and, checking in on your reproductive health is totally different from the beginning of a IVF journey to what you need actually later in pregnancy when you want to plan around delivery. And so those are all really different points in the process. So actually you'll need to be on top of all of those different trends. But I think, again, just keeping that conversation open, keeping information coming in that's from good sources, and then customising it to what your employees need and want. That's the kind of...
Great, thank you. There's a definite need there, because our poll, 88% of people said. Yeah. It's like being on that game show, isn't it? It's not really. But anyway, should organisations play a more active role? 88% of our audience said yes, so there's definitely a need there. Okay. All right, final question for today, coming to you, Rosie. So how can we equip our colleagues with supporting their colleagues with baby loss grief? Can you recommend anything we can consider?
Well, I would say get in touch with Tommy's and talk to us about our line manager training, because the reason we picked kind of line managers as a population to focus on was because people always remember how they're made to feel. So a policy is great as that kind of immediate first step. It's the kind of framework you go, okay, this is what we need now while we work out what happens next. But that conversation is so important. And also it's quite unfair. I think we put a lot on managers these days, like they're expected to wear a lot of hats and be very empathetic to a lot of situations that you might not have personal experience in. And particularly when it comes to pregnancy and baby loss, where it's so sensitive, there are things to say and not to say. So one of the things that I remember very early on speaking to one of the midwives that works with us at Tommy's was, if your sentence can start with "at least," probably just don't say it, because it might be. So often we're trying to find solutions to make people feel better. Like we want to fix things. Like we really, we've all been in conversations, maybe not about pregnancy loss or fertility, but about lots of situations where you just want someone to feel better, and you are kind of powerless to do that. And the way that you do that can be to say, well, at least X, Y, Z, and actually that can be quite minimising to someone. And actually all they need in that moment is just support and say, I'm so sorry that's happened to you. I think what can be really helpful as a colleague, as a manager, is to be really proactive with offering some potential support for someone, to say, okay, well, why don't you take 3 days off now, and we'll work out what comes in later. But sometimes saying to someone, what do you need? Tell me what you need. It's quite a lot to ask of someone who might, if they've just had a failed IVF cycle and they've had to come back to work and they're not fit to work. Then putting the burden on that employee to then tell you what they need when they are just trying to get through the day, it can be unintentionally quite painful. So I think as a colleague, as a leader, as a kind of organisation, being really kind of proactive about, we've thought about this situation. It might not be exactly what you need kind of ongoing, but this is our suggestion. It actually goes a really long way, because it shows that you are prepared in some way, instead of kind of fumbling around. I remember speaking to one parent who said that by the time that her organisation had worked out what they could give her in terms of her entitlement after her miscarriage, she was like, it's done. It's like, the time for that kind of support is past. And, whilst they did the best they could going forwards, because they weren't prepared up front and didn't have that kind of proactive plan in place of what do we do if someone comes to us saying that this has happened, she needed support in the here and now, and it's a very immediate thing that you go through. And so that's like what I would say. I'd say absolutely talk to people, don't be afraid to address them, speak to people like Tommy's, and come to us and talk to us about like the training, the support, the guidance that like our midwives can give on how to have that conversation. But also as an organisation, like it's not something that you can ignore. Kind of around 1 in 4 pregnancies in the UK will end in loss, and we've had stats on how many people are going through fertility treatment. You might not think it's happening in your business because people aren't telling you, but it absolutely is. And the more proactive you can be, the more you will start to see like better retention rates, better loyalty, people like more motivated to come back to work, less sick leave because people are not using it to go for leave for fertility or for their loss. So I think being really, that would be my key takeaway, like being really proactive, just and it doesn't need to be, you don't need to do a huge overhaul of things to make a really big difference.
Great, thank you very much, and thank you very much to all of you today for joining me and sharing all of your insights on this sensitive subject. So it strikes me having a really clear policy, but actually then treating people as individuals. Leaders have a big role in terms of role modelling, being vulnerable and bringing this to life for people and showing people that they've got a real opportunity to engage with the subject and where to get the information. All key points to how we make this a much more supportive environment for us in our workplaces. So thank you for joining us today. Our next event will be coming back to you in September, and it's around unlocking the potential of multi-generational workforces. We'll be in touch nearer the time, so you can sign up for that. Remember to also check out our Academy for practical health and wellbeing tools to support your people. Thanks for joining and have a great week.